So first of all, thank you for this amazing introduction, and thank you Dental XP, because really, I guess that education is something that has to be carried on in a professional way, and the Dental XP family is doing great, spreading education worldwide. Thank you for this invitation. Let's go directly. I come from Rome, Italy. David told you about my apartment that is on the left there, on the top. And you know, even if I spend most of my time in the office, unfortunately, but anyway, this is my life. 50% of my time spending with the patient, taking care of my patient, 50% developing new protocol, mostly based on digital stuff. So right now, I have more than 10 years of experience with the guided surgery and guided prosthetics. And we start with the small cases up to the most challenging cases. 10 years ago, working with digital was something for sure not worthy. It was really crazy because the digital workflow at that time was very poor. However, in less than 10 years, digital has become a sexy topic. And that's why I was recently invited to open the AO Academy on this topic. So really, the world is changing. We are paying more and more attention, merging together the surgery and the prost. And first of all, digital is the best way to put together the two parts of the same medal that are so important for the final results. So we started at that time, this is a very old case, with the anterior zone, because we didn't trust that we could carry on full arch cases. However, facing the anterior zone is not a simple case, particularly when there are some teeth that need to be extracted, because everybody knows the problem related to the implant positioning, the implant depth, grafting or not grafting the sides. But anyway, we try to merge our conventional experience with the digital workflow, because for sure at that time, it was not a streamline. It was plenty of drawbacks. However, what we appreciate immediately is that the true advantage of working with guided surgery is not drilling through a bushing, but planning properly the implant positioning with a prosthetically driven fashion. And most of all, fabricating in advance what will be the final prosthetic contour. So we start immediately from the prefabricated provisional to deliver the ideal shape that we want to deliver in the final step. Because it's the time of the implant placement, the right time to affect the biology and carving the soft tissue and guiding the healing of the soft tissue. And that's why we started to develop a new concept, that is the prosthetic scaffolding. That is something that is not new at all, but is something that is still tricky to understand. When we place an implant and we deliver immediate function, we have the great option to guide the soft tissue healing around the prosthetic contour. So we need exactly the right amount of acrylic, because I don't want to grab space to the soft tissue. The soft tissue is really the key. And over time, we start to follow up this case. 1 year, 3 year, 5 year, 7 year follow-up. And the soft tissue is still there. And the prosthesis that we deliver resemble exactly what we deliver the day of the surgery. What is important is not only the shape of the soft tissue, but also the function of the soft tissue. Because I don't want to experience any bleeding. An healthy interface means something that is pretty pink. That's why we started to investigate this critical interface in order to understanding if we can find the magic number. And that's why we started to recall several of our patients, and we started to measure with the CBCT all the pontic sites where flossing didn't cause any bleeding. But we'll come back on this point. That's for sure very, very important. So the soft tissue can guarantee over time that the bone will remain here. So the soft tissue interface is the critical zone. Regardless if we are going to embed our prosthesis into the soft tissue or we are going to float onto the soft tissue. Another amazing concept, the soft tissue-driven implant treatment. And I was so wondered when finally, working with the software, I was able to plan the implant positioning according with the ideal running room, with the ideal architecture of the soft tissue. Because this is the key when we talk about aesthetics. We need to fit this running room properly. If we don't fit the shape with the porcelain, it will be not enough to deliver a beautiful porcelain to accomplish the aesthetic demands of the patient. That's why we need to develop this critical zone in the ideal way. Because we are challenging the nature. We are challenging the critical zone that is in between the bone and the prosthesis. So if we want to go into the soft tissue, we need to reshape the soft tissue properly in a consistent way. And we need a rationale that is a biologic rationale and a prosthetic rationale. So let me give credit to David Garber and all the team, the Atlanta team, because they foreseen the problem several years ago. And this statement really is guiding my approach every day. Because we are delivering implants in very young patients. And if we don't take care properly of the soft tissue, augmenting the bone is not enough. It's not enough at all. So when the soft tissue is missing, we need to stage the surgical implant placement. When the soft tissue is a critical part of the treatment, we need to try to deliver a bloodless surgery, because we don't want to give any injury to the soft tissue, to the periosteum, to the blood supply. And even we are developing this concept starting from a single tooth. It's a very critical situation because if you look at the roots, they are very close to each other, so the bony peaks are very tiny, and the periodontal attachment of the adjacent teeth is very fragile. So in this case, we need to stage because we want to develop a nice environment that will be made by bone and soft tissue. When the soft tissue is there, what currently we are doing, and this is the latest proof of concept that I'm developing, is carving the soft tissue into the software. Because again, I don't consider guided surgery or the laboratory software are something that is only helpful to deliver a nice prosthesis. We have the great chance to manipulate the soft tissue in advance, because we can take, with an intraoral scanner, the impression of the soft tissue. And we can carve the soft tissue ideally, and we can fit this space with the proper prosthetic contour. Because when we are in the surgical theater, we don't have time. We don't have time to take care of this small detail. And again, when we deliver immediate function, that is the time to deliver the proper prosthetic contour. So going back from the prosthetic software to the surgical software, this means guided implant positioning, in which the prosthesis can confirm or not that the implant that we have planned is in the right position. So implant is a mix of technical limitation, anatomical limitation, that needs to be considered. So we can go back and forth from the prost to the surgery. And we can adjust the implant positioning in order to fit what will be the ideal prosthetic contour. So this going back and forth is really the key. It's better to spend more time in advance than later on. And regarding the bloodless surgery, let me show you this latest protocol. So what we did is planning the fully digital case. So everything has been virtually planned, the implant positioning, the prosthetic contour, and now also what I'm doing with this microblade is guided by the prosthetic contour. Because as I told you, I want a bloodless surgery. Placing the implant in the stereo zone is something very worthy. We are going to publish 10 years follow-up with the use of guided surgery in the static zone. Because the difference between succeeding or getting a failure sometimes is a matter of less than 1 millimeter. So be accurate is for sure the key. Be accurate and meticulous in our treatment plan. So after implementing the soft tissue and the bone, we can place our implant. We can deliver immediately a digitally fabricated crown and waiting for the healing of the soft tissue. And what we can do is a stressless surgery. Because if we plan meticulously in the virtual world, we can simulate what the patient has lost. The tooth before the surgery and after the surgery. And it's amazing because new concept, new biologic concept can be developed from this type of approach. Because the 3D implant positioning can affect the healing of the bone. Placing an implant closer to the central incisor in case we have a tiny bone peak can increase the width of this tiny bony peak. And this will support the papilla. So guided positioning, guided surgery, guided prosthesis. So again, it's a matter of understanding the digital working and all the new evidence that can pop up from this way of approaching the modern implant dentistry. But let's try to apply what I quickly show you for a case like this. Because this is a case of terminal dentition.